Okay, welcome, ladies and gentlemen, to the Board of Health meeting, September 14th at 12:30 p.m. This is live and recorded. If I start mumbling, just give me a kick in the side, please. I'd like to call to order. I'd like to move the approval of the August minutes, if that's possible.
So moved.
Do you have a second?
Yes.
Is there any discussion, house cleaning, anything that needs to be done? You're good? For a vote? Those in favor?
Yeah. Aye.
Aye.
It's approved. Moving on and having fun. Lindsay, situational update. You're on.
Sure. Lindsay Bond, epidemiologist for the city of Nashua. So for COVID-19 in New Hampshire, we've had a total cumulative case count of 346,627. We've had 151 new cases reported yesterday, and there are currently 103 people in the hospital positive with COVID-19. There are currently 17 of those patients being treated with antiviral medications. For a cumulative death count, we've had 2,676 deaths in the state of New Hampshire. For Nashua statistics, we've had a total cumulative case count of 24,722, and 7 new cases were reported yesterday. This is obviously an undercount because it is only a few PCR tests that are being recorded on the DHS dashboard. We've had 162 deaths in Nashua. There are currently 21 patients positive for COVID-19 in the hospital, and 5 of those are being treated with antiviral medications. For the CDC community level, there is a little bit of an update for this metric. So before, it used to be just how many new admissions per week per 100,000, and also how many beds were being used per 100,000. They have also added number of new cases per county. So it used to be just focused on severity of disease, and now they are counting new cases as well. As of right now, we're at a medium level. So recommendations from the CDC is that if you're at high risk for severe illness, talk to your healthcare provider about whether or not you need to wear a mask, stay up to date on COVID-19 vaccines, and get tested if you have symptoms. Obviously, people can choose to wear a mask at any time if they feel more comfortable doing so.
Thank you, Lindsay. I also have a second sheet.
I was about to go over that.
Go for it.
So for an update on the new boosters. So there is a bivalent booster available. It is a booster that targets not only the virus we saw back in March of 2020, but now Omicron that we've been seeing since January of 2022. This was approved on August 31st by the FDA for emergency use authorization for Moderna and Pfizer. The Moderna booster is recommended for individuals 18 or over, and Pfizer is for anyone 12 years or older. The new bivalents are also going to be offered and almost replacing the old boosters. It's going to be the only one that's offered right now because we know it's going to be more effective. And I did want to mention this is only to be used as a booster as of right now, so individuals still need to complete their primary series, and then they can get the booster. Individuals do have to wait about 2 months before getting a booster after getting their primary series. And according to the FDA, there are no new safety concerns with the bivalent boosters. There was some clinical trials with other bivalent boosters with different COVID-19 variants, so we know that this is safe. And I did want to give a quick update on monkeypox as well. So we've had a global case count of 59,179 with 19 deaths. In the US, there has been 22,630 cases, and 1 death has been reported in Texas. New Hampshire has had 25 cases since the beginning of the most recent outbreak. And for vaccine strategy, we're still offering the Jynneos, the PrEP, and PEP vaccines. DHS did report today that our supply is greater than our demand. So they will be changing some guidelines as to who is eligible for the vaccine to hopefully use that supply a little bit more. And that is all I have. Any questions?
Thank you, Lindsay. Any questions from Lindsay? Stephanie?
No questions per se, but just a few comments. Really appreciate the streamlined and up-to-date report. Going backwards regarding the vaccination strategy, so just to be clear for people that might not be acronym engaged, so we're offering pre-exposure prophylaxis for people who might be in high-risk situations and post-exposure prophylaxis to try to get to prevent people from getting the disease if they were exposed, but that once you have the lesions, the vaccine would not be something that you would get.
Yes,
Am I saying that correctly?
Yes, that's correct. So for the post-exposure prophylaxis, that can be offered up to 14 days after exposure. Within the first 4 days, that is going to be the most effective at preventing symptoms, and then after that, it will mitigate symptoms if someone were to get monkeypox.
So very important that people that become aware get to their primary care or to the vaccine clinics as quickly as possible. And then working backwards to our new bivalent vaccines, just a few quick add-ons. One is that people should be aware that the bivalent, the theory of bivalent is not new. When we get our flu shots, there's 3 or 4 different varieties of flu in there. So this is something that we've been doing for a long, long time. Pneumonia shots have 13 or more than 20. So that part of it, it's good to know that there have been no reported reactions, but that sort of the idea of it, the concept of it, is something we've been doing for decades. The other thing is what isn't stated here and is just, being considered is what do you do if you've just had COVID? So the current recommendations are to wait the 90 days and then to get boosted, because we know that the immunity for protection against the hospitalization and serious illness or death does reduce over time. So I just wanted to make sure that that was part of our notes.
Thank you.
Yes, that is correct. And Dr. Chan from New Hampshire DHHS did recommend that you can actually wait just a little bit longer, an extra month or so, to actually get the vaccine after having COVID as well. So something to consider.
There was also a question, excuse me, there's also a question on whether you can get your flu and the booster at the same time.
Yes, you can.
Thank you. Any other questions? Thank you very much, Lindsay. Appreciate it. Moving on, Bobby, please.
Yes, thank you. Yeah, so I'll just start a quick read of our vision and mission. Our mission is to promote, protect, and preserve the health and the well-being of the Greater Nashua region through leadership and community collaboration. Our vision is to have an informed, safe, healthy, and resilient community where all people can thrive and prosper, and we subscribe to the following values of integrity, leadership, adaptability, and respect. With regards to an operational update, our reaccreditation process, as you know, has begun over several months now, and the reaccreditation coordinator and our co-coordinator have been guiding the process with our domain captains. We've also had the opportunity to send out completed domains so far out to reviewers that we've been able to recruit from both our Public Health Advisory Council and our Board of Health. Thank you very much. And as the documents continue to be completed and finalized, they will be sent out by the 2 reaccreditation co-coordinators. So far to date, we've sent out domains 3, 4, 6, and parts of domain 2, and we're getting some feedback on those from the reviewers already. We, continue to provide weekly COVID testing to our staff internally, as we still have COVID circulating in the community, and you've heard the updates from Lindsay, our epidemiologist. In the month of August, we had 2 staff that did test positive for COVID, and both are doing well. We don't have any current positive cases as of this month in the building. We still are asking people to wear masks in required conference room spaces and in common areas, and we still ask the public to wear masks when they come into the building as well. We continue to have our weekly incident response teams where we get the updates on what's happening, all things COVID, all things monkeypox, and anything else that is impending as an emergent issue for our public health, environmental health, or welfare staff to address. And we continue to participate in calls with the state, and we do our weekly joint calls with our medical partners. Oh, we've missed you, Tony. I gotta get you back on that, the agenda for those. The joint calls, we still have those. We gotta make sure that, yeah, we gotta make sure that we get you back on those.
Sorry.
No, I just
I
realized
enjoyed the
that.
break, though.
Our EPI and our community health, public health nurses continue to meet regularly with the Department of Health and Human Services at the state level with regards to all of things pertaining to our response to monkeypox and vaccinations and treatment. Let's see, as far as a financial update for us, the CDC, or Center for Disease Control and Prevention, has announced a new workforce development grant opportunity. So there's still the recognition of the importance of having a workforce capacity to be able to respond to all the things that we're seeing. And so a request has gone out for funding. I actually attended a webinar with this information. The only problem is that it's for large cities, and so we just get knocked out of that right away. You have to have at least 200,000 minimum in the population to apply. So I did send an email up to our director for DHHS, and they're gonna apply for it, and if the state gets it, then they'll disseminate it down to the public health regions. Because it's really important for us to maintain our public health workforce. With some of the funding changes for COVID and ARPA funds, as those decreased, from the CDC, the state started to let go of folks, but we still have public health things that we need to respond to. So this money from the CDC will help maintain that capacity. During the month of August, some of the activities from the Department of Community Services are listed in my report, and then each department coordinator has a fuller report for you to read more details, but just some highlights. We continue to facilitate mental health first aid, training by our behavioral health specialists and our behavioral health strategists. We've been able to do those with first responders and with our community emergency response team members. So our CERT members have also gotten that training as well. We've had sessions that have been conducted here in City Hall as well as at the Ollinger Street Community Center. There was also a photo roast project that was presented that usually focused with our kids that attend youth serving organizations, and they focus on what, this theme was, what is resilience to them. They had some fabulous pictures. Hopefully they're on our website of the kids that responded to that. And the other update on here that's worth noting is that there's a new access cable show that's been started by our behavioral health strategist, and it's going to be in multiple languages, and so it'll be in English, Spanish, French, Spanish, French, and Portuguese. So they'll have segments, and that will be weekly, and it'll be on public health topics. Our community health workers continue to participate in community events and build partner relationships with community members and facilitate support for employment, as well as connecting folks for mental health things. And they continue to run the Cooking Matters nutrition sessions within the community, and they've started working. They have one set of sessions right now that are in place for Spanish speakers. You've heard from our EPI. She continues to monitor for COVID and monkeypox. She's been providing updates for me to present for the mayor and our executive leadership team, which is a national group of the CEOs of the hospitals and community health center and mental health centers. She's been working on the data for my sidewalk and has participated in an after action report that was delivered to our emergency management directors in Milford and our health officers there as well. Our health promotion and communication specialist, as you know, has taken another position, so we do have that position posted. But we do have our PHAP that is filling in the gap, along with Jane, who is our public health strategist that is keeping our newsletter up to date and making sure that we stay relevant with our information in our community. Let's see what else here. The group together has been working on our public health advisory. We try to do an annual event, and so we've been plugging away at trying to get speakers for that, which I think October must be a busy month for people because we've been getting turned down. So we might have to push this out. Right now, the grant that we have for Public Health Network Services for our Public Health Advisory Council is that we have to have two big annual, 2 meetings in the year. So we're trying to get one within the first 6 months of this quarter and then have one in the second half. So if we end up pushing this one out, hopefully we won't have to go beyond December to have this meeting. Our Public Health Emergency Preparedness Coordinator has been participation in planning and preparation for the upcoming city event of Holiday Stroll. Has been engaged in planning activities for National Preparedness Month. September is National Preparedness Month, and September is also Behavioral Health Month? I think Recovery Month, Recovery Month. So there's been lots of activities that have been centered around those two things as well. And our equity officer has been participating in these events as well, is also our co-coordinator for accreditation, and is working on preparing and coordinating a language access plan for us at the division. And I'm not sure if you guys got a chance to meet at Ida Muniz. Okay, I'll make sure that she comes over just to introduce herself at the next board meeting. She did start in June. And this is a position that is our thought leader around equity, so that we can make sure throughout all of our processes, through our data collection, our programming, surveys, and all the things that we're doing, that we're using an equity lens with that, and then also making sure that that is also coordinated and shared with our Public Health Advisory Council and other members in the community that we work with as well. Okay, and that's it. Staffing updates, we have a public health nurse position that's posted. The program, we're gonna hire a program assistant. We had a program assistant that went downstairs to join community health, so we have that position open. And then we have the health promotion and communications specialist position that's open as well. And then the rest of the report is just some of the boards and commissions that I've attended, and a couple of highlights. This week is Welcoming Week, so there's a bunch of activities that we'll be doing. Well, a few, I said a bunch. A few activities that we'll be doing at the division. The mayor raised the recovery-friendly workplace flag on Monday, and then today the Brazilian flag was raised in celebration of 200 years of independence for the Brazilian holiday. And that's it.
Thank you, Bobby.
Any questions?
Any questions? Stephanie?
I have a question about monkeypox recommendations. And I don't know if this is you or Lindsay, but some of your remarks brought it to my attention. So at the beginning of the COVID pandemic, we had a lot of recommendations around hand sanitizers and surface sanitizers, and we subsequently found out that COVID was more of an aerosol transmission. But monkeypox can live on surfaces, and notwithstanding that it seems like transmission requires very close contact, have any recommendations been issued for our first responders, for our restaurants, relative to the kinds of sanitation protocols and prevention protocols that might be necessary to keep people safe?
I'm going to defer to Flavia on that. I don't believe so, but Flavia and Lindsay attend the calls that we have three days a week, and so I don't recall there being anything in particular around contact and sanitizing. I know instructions have been given around just reducing exposure, but I don't have an answer for that. Flavia?
Right. Yeah, all the recommendations that I've seen in regards to sanitization, cleaning has been focused on the home environment, because those are the people at greatest risk. I have not seen any inclusive of the CDC in terms of, external of the home type of
Okay.
protection.
I hadn't seen anything, but I thought you guys are in the know, so.
Yeah.
Appreciate it.
It appears, as you mentioned, it requires usually close, prolonged contact. So I don't think that people outside of that immediate environment are at greatest risk.
Okay, thank you.
Yes, and I was going to mention also the CDC has released guidelines for communal living, like dormitories. So that is available, and we did communicate with Revere University to make sure that they're aware of those guidelines too. There hasn't really been many conversations with DHHS, and the CDC has not released any true guidelines as far as first responders go. Because they may have some close contact, but as Flavia mentioned earlier, probably in the home is going to be the greatest risk.
Okay, thank you.
And I'm not sure if in food service, because people work where they work, right? So people can be in food service, they can be in hospital settings, so I'm not sure if in some of the meetings that Heidi's attended, if they've had any special thing for food service handlers or anything.
No, I'm thinking, though, that it was probably during one of the outbreak team conference calls, there was something mentioned about surfaces, but it wasn't specific to a specific industry, and it was like Flavia said, it was more the home environment that they were most concerned about, because most of the linens in food service get laundered pretty frequently, or they don't have them.
Thank you.
Good question.
Oh, well, a follow-up to that, anything updates on daycares? I've been asked a few questions, because there's been conflicting reports on, because kids get down and dirty in the sandbox, they
Right.
rub their skin together. Is there anything that I should be telling them differently, that you've heard?
I haven't seen anything, no. Yep, I think the biggest thing with kids, our messaging, when talking with like childcare centers that call in and everything, is that monkeypox is one aspect, but, there's so many other childhood illnesses that can start as a blister or a rash or something like that, that it's essential to see their provider in order to kind of assess what the situation is and look for alternative
Yeah, that's what I would
diagnosis.
say. Okay, perfect, thank you.
Yeah.
Yeah,
I can see the concern for hand, foot, and mouth disease, because you get the blisters in the
Yes,
mouth and on the
right.
hands and on the feet
Right.
that could be confused for monkeypox.
mm-hmm,
And a few years back, even at Londonderry High, my kids actually ended up with hand, foot, and mouth disease in high school, because they didn't go to daycare, and so they had the blisters on their hands and their feet, so that is something to be mindful of.
mm-hmm.
Yeah.
And one more question, sorry, Bobby, about your grant about workforce. So as an end around, in our talk, we talked about our catchment area was 213,000. We serve not just Nashua, but all the surrounding communities. Is there a way to include that as our data so that we could be eligible for this 200,000 population, or not really?
Well, that was, I think, I'm not sure if it was Lindsay, someone mentioned the fact that we should probably look at the Hillsborough County, because if we included both Manchester and Nashua in that, that's well over 400,000.
Yeah.
I don't know if, I didn't have a conversation with the director in Manchester about this, because we would have to do something that would be collaborative
Oh.
together
Okay.
with that. And then other than that, it would have to be like at the county level. And we've never worked with the county to get federal funds, not in that way from public health. Right now, they're trying to administer the ARPA funds that came to the county, which has been taking a lot of time, so this will be just something else to throw on their plate. And I think the turnaround time with this is relatively quickly, so I just pushed it up to the state.
Okay, no, fair enough,
Yeah.
thank you.
My only question would be, what is the staffing needs that you have? Are you finding it hard to find applicants like other people are in the outside world?
Well, I know so far with the public health nursing position, we've had a couple of folks that interviewed that turned the position down because of salary. Some of the folks that have applied, I believe, was a person that worked at the hospital. We're not going to be able to compete with hospital salaries for nursing. Public health nursing is not, the pay scale for public health nurses, even at the market value, is not at the same as it is for working in a hospital. So we would not be able to hire a nurse at the same rate that they would be getting in a hospital. So far, that's been, I think, the biggest challenge so far.
It has been.
Is that
Mhm.
something that we should review, what that salary is, entrance salary?
Well, we've just reviewed salaries. We've just increase salaries, hopefully this evening. The Board of Aldermen, that's going to be on their agenda tonight to approve what was proposed was it last month? It was last month, right? It was last month. But we've already gotten ourselves into that, that space of where, for the market value for our public health nurses, we're already there, so, yeah. I mean, nurses in the hospital now have, the opportunity to get like $5,000 and $10,000 sign-on bonuses. They've increased their salaries by, Chuck, you could probably talk about this, by a lot.
Overtime opportunities.
Overtime, yeah, we just, the most that we could offer is that our community health department and our division of public health is the best place for any nurse to work. We've got fantastic staff, great learning opportunities, and the person just has to want to really work in the community. Yeah.
Yeah, definitely a different breed. We just have to see how it shakes out. I'm sure Alderman is behind us 100%.
100%.
Thank you.
Mm-hmm.
Okay, that was my question. It sounds like we're all in the same stew. All right, any other questions of Bobby? Seeing none?
Thank you.
Move on. What do I have next? Community health development? Somebody doing that, Bobby?
Yes.
Thank
Yep.
you.
So in regards to our programming, some highlights from the past month and upcoming. We've seen a general increase in volume surrounding all of our services, both in in-house clinics and during outreach. For COVID, we continue to provide the vaccines for all eligible individuals 6 months and older. We just received our bivalent doses this past week, and we started administering those this week. We increased the number of clinics to serve school-aged children with vaccines, including in-house, and we did some external clinics at some local schools as well. We start our Nashua School District school-based flu clinics next week. Over the following 5-6 weeks or so, we'll be going to all Nashua schools to provide vaccine for all students and staff, and 2 charter schools as well. For monkeypox, as Lindsay mentioned, we are providing the Jynneos vaccine for pre- and post-exposure prophylaxis. We have done 16 doses so far. We had a wait list going until we got our supplies in, and we've gone through our wait list. So now it's, we haven't seen as much demand overall. We haven't seen any new phone calls since 8/26 for people inquiring about it. We did some educational presentations to the public. Lindsay and I did one at the Nashua Public Library in English, and I also did one with Robert in Spanish, our community health worker Robert, in Spanish and Portuguese as well. In terms of staffing, we do have 2 openings, as Bobby mentioned, a full-time and a part-time position. We just hired 2 per diem nurses as well. One started yesterday and one will be starting next week. Our immunization coordinator, or prior immunization coordinator, Jen Swabowicz, is now a school nurse with the Nashua School District. And Tricia Glassstetter, who's been with us for 3.5 years, she moved into that position to fill that need there. So our lead program is now being balanced, juggled between our staff in-house. And all of our all non-Spanish speaking staff are currently enrolled in a Spanish class for healthcare professionals, and that's been going really well. And other little news is that Kim Bernard began serving on the Nashua Police Athletic League Board of Directors. And that's it for our highlights.
Thank you very much. Any questions? Stephanie?
Thinking about your comments, Tony, about the difficulties of recruitment and being in the stew, because we're so connected to Southern, which is connected to Elliott through Solution Health, the nursing population is aging, and there are nurses that are not able to keep up with the demands of a COVID environment. So just a thought that connecting with employee health or the human resources departments of those hospitals, when counseling people that are trying to step back from the intensity of the inpatient environment, perhaps they could find a new home.
Mhm.
Just a thought.
Yeah, no, that's great.
So, did you have something?
No, that's an idea, yeah, great
Yeah.
idea. No, thank you.
At one
Thank you,
time,
Stephanie.
maybe my mind going crazy, but at one time, were we coordinating with the parochial schools with vaccinations?
I've been at the division for 5 years. It could have been prior to my time, not within the past 5 years.
Yeah,
Yep.
I'm pretty sure we did, and there was
Mhm.
other things too, but they must have gone in a different direction.
Yeah.
Okay. That's
We
fine.
can always reach out and see if they're
I
on
didn't know
board and
whether
if
there
there's a
was-
need.
there was some turmoil, bad blood, or whatever. I hadn't heard anything, but it's been a while since I sat on the boards.
Mhm.
But if you, I think it's a good gesture to reach out,
Mhm.
offer that service, even if there's a fee for it or whatever, just say, hey, we have the service, and we would love to do you at whatever, you know,
Yeah.
assuming we have the manpower to do that too.
Right, yep,
I don't want to put more on the backs of people that are working, you know,
yeah.
crazy as it is.
Fortunately for us, the state does provide the flu vaccine for all kids in New Hampshire, free of charge. So that's something that we do have going for all of us, for our community, state actually as a whole. Yep, but we can certainly do an outreach for them for next year's and see if they get some feelers, see if they would need it.
I can give you a contact name and kind of go from there.
Mhm.
Stephanie, follow up?
Tony, you have to move forward.
Oh, sorry. Stephanie, follow up?
Unfortunately, polio has been identified in New York. Cases as well as presence in the wastewater. And sections of New York have declared a state of emergency relative to this outbreak. Fortunately, I'm not aware that New Hampshire has been affected yet, and I hope it never will be. But we know the pandemic has reduced the percentage of children that have received all of their childhood vaccines, as well as raised concerns among certain parents about getting those vaccines. So knowing that we like to take lessons from COVID and now monkeypox about getting ahead of the curve, either today in someone's remarks or next meeting, would love to hear what our contingency plans are for upping the vaccination rate of our New Hampshire children.
Okay.
Maybe you want to speak to that now, or?
I can,
put it on the agenda for next month?
I think we can put that on the agenda for next month. I can most definitely give a better answer in a few weeks.
Yeah, we don't want to put you under the gun there. Flavia, have you got more pages with your report?
No, I just went through the highlights, and
Okay.
then the remainder of the report has more numbers of, and how many people
Okay.
we served during clinics and.
I do have a suggestion.
Mhm.
On the immunization program,
Mhm.
I think it would be informative, I like the numbers they presented in the chart,
Mhm.
but maybe similar to about, say, you do kind of a running total for that year, so we can kind of compare how we're doing.
Okay.
Is that possible?
Sure.
I mean, if you've got the data, is it just pushing an extra button and making another chart, or is it going to drive somebody crazy who's going to shoot me?
I'll have to check with the
Mhm.
nurse who's running, who's running the numbers,
Okay.
yes.
If they could do that, that would just give us kind of an idea.
Okay.
Thank you. I just have a question about what you just said about the polio being identified in New York. Is that a one-case type thing or several cases?
There are several cases, but the polio does not cause symptoms in every individual that's affected.
Mhm.
So once they realized that there were not only several symptomatic cases, but also that it was identified in the wastewater,
Mm.
which is a technique that has been used throughout the COVID pandemic to see where surges were and what variants were. People realize that it's probably out there in the community, And the concern would be that people who are not up to date on their immunizations would be at risk of developing paralysis from the polio. And at this time, there is no known treatment for polio, so very important that people are protected with immunization.
Any other questions? Thank you, Stephanie. Moving on, Heidi?
Good afternoon. Heidi P. Kokoka, Nashua's Health Officer. And I will go over August's report for this past, well, sorry, I'm boxing myself in a verbal square here. I'm going over August's report. And let's see. And I'll just do the highlights as well. We do see a little bit of a bump up in our failure rate for August, but there's nothing dramatic pushing behind that. There's not a common thread that we're seeing. But certainly food service continues to be significantly impacted by staffing numbers and the availability of staff, and getting them educated and trained is really a hard thing to accomplish. I would say that staffing is one of those universal issues right now. So it's hard to say what that is, but it's not significantly higher. And there were no license suspensions, so that's always a good thing. Septic plans still continue to keep Ren very busy, and he is now taking Tim Poitras out into the field to train him for septic duties as well. And then when Tim is up to speed, it will be Michael McGinnis's chance to become more familiar with septic systems in the approval process and all of the field work and all the calculations that go into the approval as well. Rest is pretty basic. We are somewhat done with our pools for the year, and there were really no new lessons. Again, staffing and accountability and trying to figure out who's going to actually do the testing. So that's probably the biggest challenge, coupled with the changes in the state rules that require the CPO training. And we advised people of that this year, and we will be out ahead of it next year and provide them with opportunities. And any time that we see a training come up, we'll blast something out to them. I did find, if you will recall, last meeting, there was the mention of the rabid raccoon that did not show up. That was in the June minutes, and we hadn't met. But what had happened was that the rabies positive had not shown up in the year-to-date number. I corrected that today so that that will live in history. But like I explained last time, it was a tremendous opportunity for us to work more closely with community health on that, and it made sure that we were up to speed with what was current. And let's see, our biggest news is that both Mike McGinnis and Tim Poitras have reached their certified protection food safety credential. And it was a grueling exam for both of them, but we're very proud of them because they hit it first time. And we have a really good grasp on where we're going with workforce development and what kind of credentials we want people to have. So that is very exciting. Ren will be speaking at the 2022 New Hampshire Environmental Health Conference. And so they accepted his presentation and all of his information. He does a tremendous job on mold and VOCs, so that will be really good. And both Mike and Tim are attending that, and that's one of the first live conferences that we've got had the opportunity to attend, so we're excited about that. And let's see. The approval of our fees, that has gone well. Appreciate the support. And some people are a little confused by it, so we're getting some information out to them because all of a sudden the number has changed. They've been accustomed to paying a single number for a while. But nobody seems to be particularly outraged, which is good. And then we've had our first West Nile virus positive batch of mosquitoes in Nashua. We did not make a lot of fanfare out of this because it's the second one. The first was in Manchester, and there's no need to spray or do anything like that at this point. And there's no indication of any human cases thus far. And Ren and I met with somebody from building department, fire marshal, and the fire department regarding what happens during fire calls to emergency situations. It's usually elderly, frail people and who are impacted by not being able to support themselves in their environment and take care of themselves. So we're just kind of at the beginning of figuring out how to deal with this. And what we're doing from our end is the fire department is notifying us every time they get one of these calls. And it's for awareness right now. And if there's something that we can see in the description that we can step in and assist with, we can. But these are also reports to Bureau of Elderly and Adult Services. So we're aware of that now. And again, we may know some of them, but we can help with sanitation or something that is in our wheelhouse. And then rodents. We are getting some phone calls in some specific areas in Nashua, and I think Bob will talk a little bit more about what we're doing for our encampment activities. And not to say that our encampment activities are the sole source of rodent activity. I would say it's more littering and improper disposal of waste. But certainly the encampments are concerning because there may not be a place where people can just can get rid of their trash. But it is a common thing within the Northeast right now. And it's like the rats kind of moved up. And if you've seen the squirrels on the side of the road, they're affected as well. And so the populations are huge. And as it gets cold, we'll start to get even more phone calls about rats and mice. And on that very glamorous subject, I think, reaccreditation. Ren has been working very hard on reaccreditation, and I think that things are going pretty smoothly. I think that we have had this is our first opportunity for reaccreditation, but it's well organized. It's actually been fun to look at what people have come up with for examples. And if anyone has been reviewing stuff, thank you very much. And we hope to shine. And that's all I have.
Thank you very much. Any questions for Penny?
There's two things I want to go back to the rodent problem. I thought the mice problem was as a result of the construction and being forced out of their habitat.
It can be, yes.
So that might be a reason. I want to talk about the Meals on Wheels. I don't know if you know anything about that, but isn't they supposed to, when they deliver these meals, check on the seniors to see if they're okay and take some type of data? so we know what they are doing or if they're okay? I mean, at one point they were doing that.
As far as I know, I don't know how well organized it is.
Okay.
But that was my understanding as well, because I've had a couple of elderly people who I've worked with, and their only interaction was with Meals on Wheels people. And it was very effective at that time. I know that any of those organizations have changed significantly with COVID. I haven't heard that they have curtailed their visits going in, but yeah, I think it still works the same way.
Okay.
Excuse me.
Any other questions? Seeing none, I'd like to move on. Bob, welfare?
Thank you. Good afternoon. Bob Mack, Welfare Officer for the City of Nashua. Just reporting out for the month of August for the Welfare Department. You can see in the report our expenditures are fairly level as compared to last year. We continue to see clients and assess need and determine eligibility and either assist directly, refer to alternative resources, or some combination thereof. Slight decrease in the percentage of people that actually needed aid that had applied, and that's can be attributed to the fact of our case technicians' assessments and referrals to other resources that are available. I know I've talked frequently about the emergency assistance funds that have come into the state and the city of Nashua. We continue to refer people to that program as it's appropriate and available, and we'll continue to do that as long as the program is operating. So we do work closely with the homeless service providers in the community as well. That is probably a good percentage of the folks that we see are experiencing homelessness. Generally around this time of year, we see a slight uptick in that population because they may have been surviving out in the community, but as the weather turns, they start to come in and seek more assistance from us, and they may be more acceptant of assistance that they wouldn't prefer on other circumstances. That was part of our conversation at the encampment meeting that we've been having monthly. Actually, we've had it twice a month now for the last couple of months. And Heidi is in attendance. Lindsay was attending as well. We have representation from the fire marshal's office, police, public works, and the outreach teams in the community, including Greater Nashua Mental Health and Harbor Care, and the soup kitchen. Part of that conversation was revolving around trash and trying to remediate those issues in the community by putting out trash totes and places for people to put trash. What they find is it's not always the homeless people that would be utilizing those trash receptacles, but it could be anybody in the community as well. Which, I mean, it's good if people are using those things, but it's not necessarily targeted and focused on the homeless population. But and they've also had some issues where those have gone missing when they've put them out there. So that's just a challenging effort that has taken place. And again, I don't know how closely it relates to the rodent issue, but I guess any trash in the community could attribute to that. Let's see, the other thing to note that I don't think I put this in the report directly, but in working with our shelter programs, you know, as we do see an uptick at this time of year, and we've seen an uptick actually across the state in general with the homeless population. The two shelter programs in town include the Southern New Hampshire Rescue Mission, which is currently for single men, and they house about 35 to 40 single men on any given night. They are expanding their program to include a program for single women, and that will be located on Toll Street. They're targeting to open that this upcoming month in October. So that should provide 15 additional short-term beds and 10 longer-term beds for single females that are experiencing homelessness. So this does not include children or families, households with children. The Nashua Soup Kitchen and Shelter is still the only program in town that provides emergency shelter directly for families experiencing homelessness. We, as a city, through the City Welfare Office, can also supplement that, if you will, through our general assistance. If a family that's homeless cannot get into a shelter program, we can place them temporarily in a motel, which we've been doing for many, many years, and we'll continue to do that as long as it's needed. But they are expected to expand their program and operations targeting December. So I think they've had some construction delays and things, but they're still working through those things and are hopeful to be expanding their program, consolidating their program to one site, which will be a good thing. And just as it was expressed, the challenges with staffing and finding, filling certain positions, a lot of our community partners are experiencing the same thing, whether it's the mental health field or a lot of these non-profit organizations are having similar challenges. But they continue to provide services and do the best we can to meet the needs of those that need those services in the community. Welfare staff have attended various community meetings, including the Greater Nashua Continuum of Care. Their general meeting also, I'm part of their executive committee, youth homeless subcommittee, and a health services coordination committee that's focused on trying to coordinate healthcare services, whether it's that in-home care, but while people are in shelter programs or possibly motels. So we're working on that and also planning for discharges from hospital facilities for people that are experiencing homelessness, which has been a challenge. And also the Governor's Council on Housing Stability, and I mentioned the homeless encampment response. Another thing to note, coming up in October, there will be a statewide Housing Stability Solutions Summit to hear some ideas of what's going on in different parts of the state to try to address the homeless crisis, if you will, that we're experiencing throughout the state. So hopefully that will be a good event to bring a lot of different partners together and come up with some good solutions and ideas to start to implement. There is funding out there, it's just how to implement the funding. The state is pushing out some additional funding, around $5 million in funding to shelter providers in communities, so these programs that are already operating, to get some additional funds to address winter shelter needs. So we'll see how that rolls out, and that's still in the works now. So other than that, I don't have anything else unless there are any questions.
Any questions? Seeing them, thank you, Nolan.
You're welcome.
Appreciate it. I have a few extra pages. Anybody can be reporting on it? Wow, it's actually the emergency preparedness.
Yeah, so
coordinator.
each coordinator on community services sends a complete report. I only give the highlights.
Sounds
So I just give a few bullets from each one, but you have their full reports that go into more details of other activities that they're involved in, and I just pull some highlights out.
Not a problem. Thank you. Appreciate it. Actually, there was just a couple of questions, but they were answered earlier, so I won't get tied up on those. Any general questions? Any comments? Sure.
Well, it's the follow-up, Flavia, and maybe for Tricia, is, as we all know, maybe not in this room we do, but maybe outside who are listening, that New Hampshire's a universal vaccine state, so we get the vaccines for free. And maybe following up what Steph was talking about polio. And we, as pediatricians, which is 300 of us plus, and through the Pediatric Society, have worked for years to get everyone appreciative of that fact. And so historically, New Hampshire, Vermont, and Mass have had the highest rates of immunization uptake. And we then finally got 2 or 3 years ago the immunization registry, which is a great success. And then everyone who came into our office was assumed that they were going to be opting in, and they had to physically say, I don't want to be sharing my data with anyone outside, so they opted out. And then through this forum here, we learned that the legislation has now changed, and that is now the norm is opt out, and you have to actively say, I want to be put into the registry. So the reason I'm saying that is my question to you is, we've worked so hard in the past with the immunization people in Concord. My question would be maybe to help with us getting data for the polio thing is if you could maybe see where we're at with our numbers. You know, Dartmouth historically has done quite well, but also around the state, we've really prided ourselves, because that's all we do. Pediatricians, all I care about is as long as they get their shots, everything else is fine. So we live by that principle, but COVID has thrown that for a loop because of not coming in. But I think nationally, definitely New Hampshire, maybe not as much, but it'd be fun to see in the sense of data, if they could help us with what they're seeing in terms of uptake, or what, you know, where they're at with something that we could usefully apply some situational responses to.
Sure.
To say maybe we need to highlight X, Y, and Z. Does that make sense?
Yes.
I'm
Yep.
asking.
Uptake for polio vaccine in particular, or just
No,
across
general.
the
I mean,
board
polio
for
is
all
one of them.
childhood
It's-
immunizations?
It's on our radar screen, but it's definitely out there. I've been asked a few questions about that, and hopefully it doesn't come to New Hampshire, but we know it's going to. Having taken care of a child with polio and an iron lung up at Dartmouth, it is not something you ever want to see. So I have a personal, emotional connection to that topic, but I think if the state part of it is so good at giving us the information, if you could help us formulate a response to this, that would be great.
Sure thing. I will.
Sorry, thank you.
No, not a problem at all. Good points.
Yeah, I was just gonna say, Chuck, so that actually is a good thing for us to look into, because we've always had like the 98%.
Yes.
We had a very high
100%,
immunization rate. And just to see what that difference has looked like from 2020 to 2022, to see if there was any big changes in the past year. And then also, like anecdotally, have we noticed, because it doesn't seem like things have slowed down in the immunization clinic as far as people coming to get their kids vaccinated.
No, it has not. We have actually seen quite a few children that are, not up to date, and we help them get up to date,
Yeah.
especially at the beginning of the school year, because all the school nurses are reviewing all their vaccines, and they're going, oh, we missed this. Absolutely.
Yeah, shout out to the school nurses around the state, are phenomenal. They're our vector to get those kids in, and they will tell the parents, you're not coming in unless the shots are there, so.
Absolutely.
When they come back to us, so we couldn't live without those worker bees either.
Yeah. So if it doesn't show up in the registry, well, we didn't have a registry before, so it was getting documented some way, somehow,
Right.
with the high rate, so I'm wondering how we capture that data now.
So that was one thing I was hoping to discuss next time, just because I know there has been a lot of challenges because we never had a system before.
Right.
And who's to say that everyone is going in retroactively and adding that, so that is going to be a challenge moving forward. And then we have this new legislation on top of it. So we can definitely look more into it, and we'll have a better report to give you all next time we meet.
Thank you.
Thank you.
Great, thank you.
And I don't think there've been any changes as far as the school with waiving vaccination, so it's still required, right? The kids have their vaccination records up to date.
It is.
It is, I guess, was twice this week, I was asked for a religious exemption and a medical exemption on 2 separate occasions. Religious, I said, go talk to your faith minister person, because I can't write a letter like that. And medically, you're not getting one from me, unless there's obvious cancer immunization and immunosuppression, those kind of things that have to wait for live viruses, but there's no medical reason not to have vaccines.
Yeah.
That's my comment, and unfortunately, I've burnt a few feathers this week, but so be it.
Just doing your job.
Any other questions for us? Like to entertain opening up any questions or comments from the public? Seeing nobody here, I would like to entertain a motion to adjourn.
Yes?
Yes.
I don't know what to say,
Yes,
yes or no?
Second.
Yay or
Those in
nay?
favor?
Aye.
Thank you. I'd like to thank everybody for taking the time to write the reports and to do their presentations. They're well appreciated. They don't fall on deaf ears, that's for sure. Thank you.
Thank you. Thank you, everyone, for all the great work.
Thanks for coming out.